So that's the kit.
So this is like a standard adult kit. The kits are pretty similar, but like for a pediatric patient, you might just get a smaller needle, you know. Okay. So basically, it starts with, so you guys have this paper, and those of you who are going to be seeing this later will get this paper. There are 20 hyphenated components to get down to the bottom of this. Each one is worth 5 points, okay, for a total of 100 points. So I'm going to tell you right now, the main thing is I'm going to tell you guys which are the required components. So component number 1 says, be sure you have the required equipment and that it is set up and in reach. Okay, guys, that's actually a big deal, okay? So if you were having a lumbar puncture, do you think you would be like thinking about your favorite song? Or like what do you think would be going through your mind when you were waiting for the lumbar puncture to begin?
That you want it over with.
That you want it over with, for sure, okay?
It's gonna hurt.
That maybe it's gonna hurt, or that it's definitely gonna hurt. So you're already kind of not at ease, right? So what if in the middle of that procedure, the doctor said, oh, I forgot something. Nurse, could you please go get me the whatever? How would you be feeling right then?
Like
The
there's a long
doctor
needle
doesn't
in
know
my
what
back.
he's doing.
Yes, horrible, right? And in the position you're going to see, you're not even seeing what's happening. You're facing in the other direction. So it is super important that you have everything you need before you begin the procedure. That's actually really important. But the only component that you guys are going to be graded on, per se, this part that's highlighted, 1 CSF collection tube opened and set up on the tray. So normally you would do this with all 4, okay? But for your rubric, you need to open the tube and set it up in the tray. There's a spot for it. Because once you get to where you have this lumbar puncture fluid, this CSF dripping out, you can just grab it and gather the fluid. As a matter of fact, if you're left-handed, you would start from this side. Okay, if you're right-handed, you start from this side. These are minor procedural things that you learn as you go along. But you don't want the CSF coming out. You can put the Stylet in, and then you're like, oh. You know what I mean? That's not something you want to be doing. You want the amount of time when the needle is in there to be as brief as possible. So in order to get the first 5 points, you need to open the top and set up your tube. Otherwise, everything that you need, pretty much only what you need is in here. So you're not going to be bobbling over equipment, okay? So you're going to advise the patient of the procedures. So what we need to hear, whether it's Ms. Jarrow or myself, risks of this procedure include infection, bleeding, and allergic reaction. That's what you need to say, okay? And then you are going to hand this form to me and say, please sign this consent form. And then I'm just going to pretend I sign it, right? So infection, bleeding, and allergic reaction. That's not all there is, but that's all you have to remember with this rubric. So we need to hear risks, infection, bleeding, allergic reaction, then hand off the board so that we can pretend we signed it off, okay? Now, another part of procedures is, unless the patient is a medical professional, they really don't know what the procedure is. There's no reason they would. There's no reason they should, okay? When you talk to patients clearly, concisely, and definitively. You don't say, oh, we're thinking of doing a lumbar puncture. Would you like to lay on your side or your back for this procedure? How would you like to do that? No, you say, I want you to lie here, facing away from me, on your side with your head here. And you don't say it meanly, but you say it definitively and crisply. Lie here on your side, facing away with your head here. That's what you want, and that's what you say. If you're right-handed, the head goes on this side, because then the spinous processes are angled this way, and you can easily insert the needle with your dominant hand. If you're left-handed, and it doesn't matter for this rubric, the spinous processes, you'll want to use this hand, so you want the head to be on this side, all right?
So do you think our lefties, like, I have a couple lefties in here in the morning class, so I mean, I'm a lefty, but I sometimes do things more dominant with my right hand. So that would obviously, if you were doing this, you would have to learn what procedures work best for you.
Right. So for the purpose of this rubric, what I need to hear is that you tell the patient you want them on their side, okay, facing away with their head one side or the other. Or, you know, if you tell them like for instance, some will say, lie down on your left side facing away. That automatically is going to result in the head being over here. You know what I mean? So, but those are the components, okay? On your side, head one way or the other, facing away. Those are the 3 components for the rubric. Those are like the definitive things that you need to hear, okay? Now you need to tell the patient is facing away, their head's over here, they're on their side, and ultimately why it's not part of the rubric, you want their shoulders square and their hips square, because you want them straight up and down, because this needle that goes through the umbilicus, you want to go to their cord. If they're like angled like this, you're going to be going into their abdomen. So they're going to want to be square. That's not necessarily part of the rubric. But you do need to tell them, now that they're there, arch your back like a cat or roll into a tight ball. And that's where they do this so that their spinous process is spread. And in real life, you know, we're going to be using a tube. But in real life, their back is like right here at the edge, because the needle's going to be here and you're going to be collecting CSF. You won't be able to do it if their back is up here. You won't be able to get the tube under there. You know? Now you're going to find the L4 spinous process by drawing a line between the iliac crests. So I'm going to have you say some things here, because this is a rubric, so that you can show us that you understand the concept. This is not what you would say to the patient. I am locating the L4 spinous process by drawing a line between your iliac crests. This allows me to be sure I will place the needle inferior to your spinal cord. You're telling me that you understand the concept of where the needle needs to be inserted and you understand the location of the spinal cord. You would never say inferior to the spinal cord to your patient. But what you would do, which is really important, is because they're facing away from you and you haven't actually really done anything yet. You're going to be touching their hips, right? And because that's how you find L4. And so when they're laying there, they might be thinking, why is this guy groping my hips when he's supposed to be doing a lumbar puncture, right? So you got to tell them what you're doing. You're going to feel me touch your hips to help me localize this procedure. You need to say something so the patient knows when they feel what they're feeling. But from what we need to hear from you is L4 spinous process, iliac crest, and location of the spinal cord. That's what I want you to know, all right? Then you got this thing here, which is our patient. Prepare the skin surface with antiseptic. You can tap it, rub it, do magic over it, whatever you want, okay? That's cleaning it. That's what that step is. Then place the fenestrated drape. So that's this.
Do we know what fenestrated means? Has a hole in it.
So, you know, we don't take this off because this is sticky under here, but in real life you do, you pull that off, and then that actually sticks on the patient so this thing doesn't move. And then this is over the spot that you've identified, the L4 spinous process, by using their iliac crest. So you center your fenestrated drape there. Then you anesthetize the skin. You anesthetize twice. So one step is anesthetize the skin at the L4, L5 interspace with a short needle. There's a short one and a long one, and this one just gets you started. Don't even take the cap off. There's no reason to do that, okay? It's just going to have somebody getting stuck. So just leave the cap on and just pretend you're anesthetizing with the short needle. Take it off, put the long needle on. This is all the stuff that routinely comes in the kit, okay? And then anesthetize with the longer needle, because you need to go in that path. If you look at that, the spinous process is on that skeleton. You got a ways to go, okay? So you need to anesthetize that path, all right? And that's this. Okay, so let me explain this spinal needle to you guys.
How far, if you were actually doing it, how far would you put the needle in?
This would go in all the way.
What's all the way? Like to the base?
Like to here.
Gotcha.
Yeah. Okay, because the spinal needle is this big. And in some people, you have to put it in like all the way. Some like big guys, some really big guys, yeah, it's amazing. They make longer ones too, okay? So this needle has what's called a stylet. And you guys are the concept of a stylet is just something that goes into a tube. And you guys will see the concept of stylet when we do intubation as well. We use a stylet there, it's different. So we have this spinal needle that has this metal insert that's called a stylet. This is the main thing I really need you guys to be careful with, because these kits are not easy to come by. Don't bend it or break it, okay? This stylet is in here because as you're trying to get to the cerebral spinal fluid, if this was open, it would get filled with cells and tissue and clotted blood, and you'd never be able to get cerebral spinal fluid out. So you need this thing to be solid while it's going in, okay? And it just fits in there. And when you insert it, I don't care how your hands are, right? But typically you have your thumb behind the stylet as you're actually inserting it, okay? So the next step is begin inserting the LP needle with the stylet in place. If you put the needle in without the stylet in place, you won't get those points. The stylet has to be in there when you insert the needle. And in real life, okay, you're going to be angling towards the umbilicus, which on the patient would be about here, and going in directly horizontally. This obviously is not a real person, okay? But, you know, I just say that because when I was doing it with my kids, they were like going like this and, you know, all kinds of stuff. You know what I mean? If you want to mimic reality, you're going to be going in completely horizontal, a little bit angled to get between those spinous processes towards the umbilicus, as it said on the video, okay? And then this is a huge landmark. You need to say, I just felt a pop as I punctured the ligamentum flavum, because that's when you stop pushing. That's the real landmark that's used in real life. That's what you need to say. You don't say that while you're actually doing the procedure, okay? You know what I mean?
Because the patient would be like, what?
Okay.
You popped my what?
What pop?
Okay. So then once your needle is in there, you remove the stylet, and that's one of the steps. Just take the stylet and put it off to the side, okay? And here's where you collect your cerebral spinal fluid. You just hold the needle on, hold this under like you're getting the fluid. And then big important thing, as it says on here, secure the cap. You secure the cap before you put it back up here. This is another one of those things that you're like, oh, an hour later, does it really matter? Well, in real life, here's what happens, okay? First of all, there's not like a fixed table next to ER gurneys. Maybe there are in outpatient procedure places, right? So the nurse rolls in this rickety four-wheel metal thing with a tube that comes up to this little surface, and that's what this thing is sitting on, okay? And then you take this and you just put it on here, and let's assume you get it into the hole and you don't do that, okay? Let's assume you get it into the hole, you finish the procedure and you get up and your knee hits that table and everything falls on the ground. And then you say to the patient, oh, I just need to repeat your lumbar puncture because I knocked your CSF all over the floor. So you secure the cap before you put it down. Then even if this thing drops, it's good. Nothing's going to happen to it. You've got your sample and it's not going anywhere, okay? So secure your cap. Then replace your stylet. This is the most careful thing. Be very careful. Just please try not to bend it, okay? Remove the LP needle. One-handed capping. You will lose points if you use two hands, okay? Because you'll poke yourself. One-handed. One hand is behind my back. I'm going to put the needle in here and bring this down. Then, only then, do I snug it. One-handed recap. What did I call that? Cover the LP needle using the one-hand method. I should like patent that.
Coin that.
One-hand method. Okay? Because in real life, you don't use any needles over again because so that you don't get stuck. This just goes in the garbage. It goes in the red box. But I only have 2 kits that have to last me however long I do this, at least another 6 months or something. You know what I mean? So don't bend it, okay? All right. All right. And then this sounds crazy, right? Put a Band-Aid on. That's what you do in real life. You just put a Band-Aid on it. You got that hole there, you pull the needle out, you put a Band-Aid on it. Pretend. Lay it down, whatever you want to do. Okay, it actually comes in the kit, the Band-Aid. All right? Only now do you advise the patient that the procedure is complete. Because believe me, they're holding still this whole time. And once you've got the Band-Aid on and you're done, you say the procedure is complete. You can move now if you would like. And then the final step is you telling your assistant to take your tubes of CSF to the lab. Because now you can't do anything else until you get those results. So if you guys were looking at this, you see we went through 20 separate steps, artificially broken up into 20 so that they can be 5 points each, okay? And you're gonna have this kit to do the procedure. Can you think of anything else?
No.
Do you guys have any questions?